Hello, good evening, guys. Welcome to the live broadcasting of Erufu, the online community medical support network. I'm Shireen. Today, actually, we are going to have a woman's topic, the problem that we girls encounter every month. But yet, the guys out there, you can join us for you to understand more about the ladies' world. Tonight, we are actually proud to invite the gynecologist of healthcare partner Erufu Care Community Medical Support Network, Dr. Zaharuddin, to share about the excessive bleeding during menses. Welcome, Dr. Zaharuddin.
Hi, thank you.
Hello, Doctor.
Hello.
Evening, Doctor.
Can you hear me?
Yeah, can.
Yeah,
sure.
Okay.
Before Doctor start about the sharing, do let me do a brief introduction about Doctor. As a certified colposcopist from British Society of Colposcopy and Cervical Pathology, okay, and a certified gynae oncologist from Ministry of Health Malaysia, Dr. Zaharuddin interest covers an extensive range of gynecological and obstetrical services, treatment and care, which includes women's cancer, abnormal pap smear, colposcopy, laparoscopy, gynecological tumors like fibroids, ovarian cysts, and endometriosis, abnormal menses, complex surgeries, and general obstetrical cases. As a dedicated gynae oncologist, Dr. Zaharuddin strives to provide professional and personal care that patients deserve. No more further delay. I shall pass the mic to Dr. Zahar.
Okay, thank you, Erufu for inviting me to share what I call this today topics. Let me share the screen first.
Okay.
Okay. Sorry.
Yeah, it's on. Okay. Okay, Doctor, can start.
Okay. Today we're talking about the excessive bleeding during menses. Menses problem usually what we call main factor which make what we call our women come and see the doctors because they themselves actually can monitor what is normal, what is abnormal for them. Okay. Today specifically, I'm talking about what we call bleeding during menses. Mean that this is what happened to women in the reproductive age group. Reproductive age group means that a woman who has ability to get pregnant. The range what maybe age about 12 until age of 52. And we are not talking about bleeding after menopause. Let me see. Okay, this is our what we call our cover today. One actually definition of excessive menstrual bleeding, and then after that we see how do you assess either your menses is excessive or normal, and the causes of common causes of excessive menses, and then what will your doctor do when you see your doctor, and we're talking about common medication, common surgical intervention, and take-home message. Okay, theoretically, based on the previous research, we conclude that every menses, every we call bleeding which more than 18 minutes per period, or longer than 7 days, or both, considered as excessive. But this is very difficult definition for women. Because why? Because they actually have a different definition of their normal menses. One menses to another woman's are different, because let's say some women has what we call 3 days menses, but when they have 5 days menses, they say this is excessive. Another woman has 7 days menses, but when they have what they call 5 days menses, for them actually less, and more than 7 days they consider as more than that. So it's very difficult to find exactly what's a heavy period, because it varies from woman to woman. So heavy menses for one woman may be normal for the others. So the women themselves have a good idea how much bleeding is normal for them. So based on their previous menses, last 3 months, 6 months, and then suddenly they found out because their menses now usually about 3 days, but now 5 days, or usually they have they use about 4 pads a day, but now they have to use 8 pads a day, more than 5 days. So they found that they find it actually this is something that excessive for them. So that's why make them worry and then come and see doctor. So for me, actually, it's depending on the woman themselves how they assess. So mean that these are relative definition from woman to woman. And then let's go what make women what they call think they have excessive menses. One, they said, doctor, I have to use double pad to prevent leaks of my period. Usually I use only one, or maybe said usually I use normal pad, but now I have to overnight pads throughout the days. This is considered excessive for them. Or some women have, doctor, I have to get up at night. Because why? Because I have to change my pad and it will disturb my sleep. This is also considered as what we call excessive for them. Some women have got, doctor, is flooding, doctor, because it's what you call bleed through my clothes and my bed is wet with the blood. And then some women, what you call, when they go to work, they have to go to what you call toilet almost every hours because of what you call the pad soak. And then another woman said, doctor, previously I only by sticking and my pad only superficial, but this time I have clots. So all these things actually considered as excessive menses. And this sometimes makes them have to take MC. So they cannot go to work because of this problem. Some women, they have what you call, I cannot go outside, doctor. I cannot go swimming. I cannot go jogging because what you call, I leaks when I have period. End of the day, they have become tired. Why? It's become anemia. And then sometimes they also come to see doctors because they say, I have painful period, doctor. And then another thing actually is period is okay, but somehow they have what they call uh, experience bleeding in between period. They say this month, last month, they have what they call period is early of the month and the following month, so early of the month, but in between this normal period, they have another so-called period. So this is also considered excessive menses for women. Okay, this is typical objective assessment by women. Look at what you call this chart. Some women usually they have relatively what they call look at their pad. They will tell the doctors because doctor usually this my period usually like this for first 2 days and then heavy period usually only day 2 or day 3 period. But now first day until the 5th days of period, I have a fully soaked what they call pets with the menses. And some women, they have what they call the application. There's a lot of application, menstrual calendar, on application, free application in the smartphone. So they can what they call tick, they can what they call see what they call this chart. They just put there this one, 2, 3. This is the first day period, second day period, third day period. So this is amount of what they call cloths or amount of the pad they use. They say this one is going to fully soak, this got 5. So this one actually, we can put it, this is objective assessment by the woman themselves. And then they come and see doctor, then they give evidence, doctor, this is excessive for us. Tampon actually somehow is not really popular among Malaysian, but most of Malaysian, they use what they call menstrual pad. When you're talking about the cost, usually what they call the can be very interview with trying costs, hormone and other illness. In the reproductive age group causes of irregular menses or excessive bleeding, sorry. Okay, one thing, this is we have to rule out pregnancy because when you have menses, mean that you are in the group of reproductive age women who are able to conceive, to get pregnant easily. Okay, most of the women, when they come and see me, when they have excessive bleeding, my first question is, I will ask them, do you think you are pregnant? Because this is a common cause of what they call excessive bleeding. So they will look at me and say, I'm not sure, doctor. So one thing I will do one is a urine pregnancy test. Most of the doctor will do a urine pregnancy test because they want the cheap, what they call cheapest and easiest what they call test. And second is what they call we do ultrasound of pelvis. And if both are in depth, we do what we call blood test, which we see the level of the hormonal pregnancy, which is serum beta HCG. And then the most common actually is a miscarriage, or if related to pain, and then most likely there is a risk of ectopic pregnancy, meaning that pregnant outside of the uterus, either the tube or other place. Another most common excessive bleeding during menses is a growth or tumor which are not cancer. The common one is actually polyps or fibroid. Polyps can be seen either what they call in the vagina, cervix, lining of the uterus inside here is endometrial polyps, or you can see also fibroid in the cervix, uterus, and the outside of the uterus. These are common cause because especially what we call uterine fibroid, because when there is a tumor, non-cancer tumor, uterine fibroid, it may cause what we call the uterus become enlarged, big, and then the surface for bleeding is more. So the chances of bleeding during period actually is more. And then second one actually is cervical cancer or uterine cancer, mean that the lining of the uterus. Another one actually the common irregular. It's not more to the excessive bleeding, but more to the irregular period, and a bit annoying to women. Actually, it's a intrauterine contraceptive device. Another common cause hormone-related problems, hypothyroidism and what they call and polycystic ovarian syndrome. Hypothyroidism means that the thyroid hormone level is very low, and in case of these two are different scenario, PCOS and hypothyroidism are different scenario, but both cause irregular menses, meaning that women may have every 2-3 months, but because of too long the gap of menses, one menses to another menses, the uterine lining the womb here will become thicker. One is too big, too much, it will come out a lot and cause bleeding, excessive bleeding, and blood clots. Another related problem actually blood causes is blood related problem. This is very rare, one Willebrand disease and platelet function disorder. Sometimes what they call a common thing commonly happen to women with dengue fever. When women have dengue fever and same time they have period, the platelet count is low. They may have what we call heavy period. Another is infections such as pelvic inflammatory disease. Systemic problem is liver disease, liver failure, and kidney failure. After what will most doctors do? Either is your general practitioner or gynecologist. After they are taking what they call history taking and physical examination. Physical examination, we see how bad is your anemia, and then what we call we usually proceed with urine pregnancy test if we suspect pregnancy. And then second thing actually we do the ultrasound. The ultrasound can be divided into two. One is trans-abdominal ultrasound, means that we do a scan through your tummy. And other one is the transvaginal ultrasound, when the probe and the scan probe actually go through what you call the vagina and scan the pelvic area. This is more accurate because the probe which connected to the ultrasound is very near to the uterus and the related organ in the pelvis. From this ultrasound, we can see one, either pregnant or not pregnant. Second is a growth, especially what we call uterine fibroid or any cancer. And then after that, most of the doctor will do what they call, will do speculum examination. With speculum examination means that we put this speculum, we open up what they call the vagina to see inside the vagina if there are any tumor, polyps, or any growth, and the cervix itself. And then we don't do what we call pap smear during period, usually. Why? Because a bit difficult to see what they call the cell, but with a new technology, liquid-based cytology, we can see the cervical cell. But you should remember that this Pap smear is only for to screen cervical abnormality, not cancer. If there is a tumor or cancer on the cervix, we take the biopsy. And then the same thing, we can do another test. We call it endometrial sampling or PPL sampling. Means that when the doctor put the speculum exactly like how they do what they call pap smear, you can see the cervix. When they put small, tiny plastic tube, flexible, from the vagina go to the cervix, go to inside the uterus, and then we take some sample from the lining of the womb. Why? From this, even though this is so-called blind technique, because why? We cannot see what inside the uterus, but we can take the sample inside the uterus, we send to the lab. From the lab, we can see either there's a small polyp or any cancerous, pre-cancerous changes on the what you call in the uterus, or any cancer cell in the uterus. And after that, doctor usually take the blood, full blood count to see your hemoglobin level, and then any other blood which the team may what we call have in their management, especially if they found what they call is the tumor, ovarian tumor on the scan, so they can screen what they call serum tumor marker. This is a common medicine that we give to what they call patient. One, actually, we know what you call when you have excessive period, it means that you lost a lot of blood. You lost a lot of what they call iron in the blood. So most of the doctor we prescribe you what they call iron tablet. This iron tablet, there's a lot in the market. Usually, most doctor nowadays they give what they call extended release iron, because when you have what they call this iron tablet, one of the side effect actually is bloated, abdominal cramp, sometimes diarrhea, nausea, your tummy a bit distended. But with the new formulary, extended release, and then so it will reduce all of these side effect. You should discuss with your doctor which medicine is suitable for you. If let's say your hemoglobin, based on the blood test, your hemoglobin is very low, normal level maybe around 12, but if you have an maybe 6 or below, and you have symptom of anemia such as palpitation, giddiness, syncopal attack, you need what you call is blood transfusion. It's based on your what you call hemoglobin level. Another tablet, popular tablet amongst the doctors is a tranexamic acid. This tablet actually temporarily used to stop excessive bleeding. Usually we give not more than 1 week, because they have another side effect such as what they call thrombosis, without blood clot in the leg. Another common tablet, if let's say we find out there's no obvious tumor, is purely what we call hormone related with the hormone cause, and then this is what usually this term we use it, dysfunctional uterine bleeding. Dysfunctional uterine bleeding means abnormal uterine bleeding in the reproductive age group after we have exclude infection, tumor, uh, bleeding disorder, and a bleeding disorder. So mean that there's no obvious causes which need surgical intervention. We commonly give the oral combined oral contraceptive pills. This is why, because one thing, we regulate your hormone level, we can regulate your period. At the same time, we reduce amount of bleeding, and if you have painful period, is reduce pain during period. And this is if you ask me, I will prefer this tablet if there's no in contraindication, there's no what you call contraindication to give to my patient. There's a lot of benefit of this contraceptive pills. Most of my patients worry about, doctor, will I gain weight with this tablet? So I look at them actually. Uh, I tell them actually, I never take these pills, but I still gain weight. You know what I mean? Because it means the gain weight are related to our normal activity intake and our output and our physical activity. So they will tell doctor, a lot of my auntie take these contraceptive pills and then they look bigger and bigger. You look at the auntie, because most of the aunties are age 40 and above. They are what you call established people in their company. They what you call sedentary job, office job. They hardly do what they call exercise. So when you see what they call the young college girls, young lady which less than 30 years old, they took what they call contraceptive pills. They are still lean. They didn't give weight, because why? Because they're still active physically. So there's a lot of benefit of oral contraceptive pills, especially because I'm doing a lot of cancer work. These oral combined oral contraceptive pills, if you take this pill for 5 years, either is continuously 5 years or accumulative. Accumulative mean that you take 1 year and you get pregnant, and then continue another 2-3 years, and then get pregnant again, and another 2-3 years get pregnant again. If let's say woman takes this oral contraceptive pills more than 5 years, the chances, the risk for them to get cancer of ovary and uterine cancer, meaning endometrial cancer, lining of the womb cancer, are reduced 50% less compared to a woman who never take oral contraceptive pills. This is very, very good. At the same time, your hemoglobin level, blood level, it will go up when you're taking what they call these oral contraceptive pills. Surgical intervention. Most of the doctors sometimes they call, when they do scan, they look at, they call ultrasound scan. Let me see. Sorry, you go back there. Okay. When you go back there and then we do ultrasound scan, okay, we see they got the lining of the womb inside here is very thick. They're suspicious of what they call endometrial polyp. Polyp is a very small growth, but when they accumulate inside it looks very thick and then very dense here. So most of the doctor either do this one. This is diagnostic. We can do this test, but we cannot see clearly what they call the polyp, and then we cannot remove it, the whole polyp. But when you do this intervention, what we call is hysteroscopy. Hysteroscopy means that the telescope you go through. Okay, let me see here. Okay, this is model. This I have what they call in my clinic. Okay, this is uterus. This is fallopian tube, ovary. This is vagina. Okay, this procedure we call it hysteroscopy, mean that we put you sleep. Okay, there's no cutting in your tummy. We put what they call the telescope right here, a very tiny telescope. The size is less than what they call your pencil. The diameter is less than your pencil, but it's quite long. Go through the what you call vagina and go through the cervix and go inside the what you call it. And then this is, look at this one. This is common, normal looking lining of the uterus. Means that this is two dimple, this two small hole here. One hole go through the fallopian tube, right side, another hole go to another fallopian tube. This is very smooth looking, and this is normal. But even though at the same time what they call we see it's normal, we have to still scrape, make sure that all these tissue are normal. And the same time, if you can see here, when you do telescope, we find there's a small polyp here. It looks huge, but actually because this is enlarged by the telescope, uh, huge here, we can cut it and then remove it. At the same time, we treat it and we know the diagnosis of the problem. Another, the same time, so we can, we can put the intrauterine system, what we call a Mirina. This is something that what we call IUCD, but this is plastic. The small size put inside the uterus, and then it will release the hormone slowly. But the aim is actually is to make the lining of uterus very very thin and to prevent any growth inside the uterus. This intrauterine system also can is a contraceptive, one of the contraceptive method for the woman to prevent pregnancy. Look at this one. When you do what you call ultrasound or MRI, we can see what you call the fibroid. Fibroid actually is a growth of the muscle in the uterus, basically. So when you do ultrasound scan, we know how big the size, where is the location, how many. And then sometimes ultrasound very difficult to differentiate between the fibroid, which is the excessive growth of the muscle of the uterus, which is non-cancerous, or adenomyosis. Adenomyosis means that thickening of the muscle of uterus because presence of the lining of cell lining of the uterus inside the muscle of the uterus. Okay, woman's uterus have basically three layers. The inner layers, we call it endometrium. This is the place where pregnancy happen, a baby is there. But if there's no pregnancy, this layer will come out and become period. And then after that, this is the muscle layer, and then this outer layer. It's three layers. These three layers is what they call, they can't mix together. But what happened is adenomyosis. This lining of the uterus, endometrium, somehow it go inside the uterus. So every month, when your uterus you can prepare for pregnancy, it become thicker and thicker, and this cell inside will also become thicker and thicker. If there's no pregnancy, it become period, so it can bleeding also inside of the muscle of uterus. Or by months, by years, so your uterus become enlarged and swollen. So this is adenomyosis, we call it. So sometimes when the doctor have difficulty to differentiate between the fibroid and adenomyosis, we proceed to do the MRI scan, because MRI scan have the better visualization of this tumor. If let's say we found there's a fibroid, there are two ways of liquor operation. Either conventional is laparotomy, is cutting your tummy like cesarean section, or laparoscopic approach, which use telescope operation. So myomectomy mean that we just remove the fibroid, so we keep the uterus. How do we do it? Mean that we cut through the uterus, take it out the fibroid, and then we stitch back. If let's say the fibroid is too huge and the woman have completed family, we do hysterectomy. Mean that we take out the uterus and the fibroid at the same time. So take home message, actually excessive bleeding during menses is one of the most common problems women report to their doctors, either GP or gynecologist. It's about 1 out of every woman has this problem. So go and see your doctor, GP or gynae. If you are worried about your bleeding, doesn't matter. You said maybe you think it's not much for you, or but it's much for other people, or your period become heavier and you have other symptoms, especially what you call period pain or bleeding in between period. I think at the moment, hello, we stop here for the excessive bleeding during period. Any questions?
Okay, guys, thanks for doctor's sharing. Currently, we are open the section for questionnaire. So there is actually a questions from the crowd, doctor. Okay.
Yeah.
Liting is actually asked, can heavy period cause anemia?
Yes. What you call is heavy period is something that what you call bleed is your glass, your uterus. Okay. Your anemia mean that when there's a lot of leaking from your cup, but your production of what you call hemoglobin is less. So when you have excessive bleeding, you will leak a lot of blood. So the production of more than production of your blood inside your body. Yes, in long term especially may cause anemia. But some women don't have what they call this symptom abruptly because it have chronic anemia for months, meaning that they have bleeding slowly over a period of 3, 4 to 6 months, and then after 6 months somehow the heart uh, can have what they call good reflex, so they don't have so much what they call palpitation, but they have slowly have tiredness. But if you have excessive bleeding at one shot, yes, you will have what they call symptom anemia, giddiness, palpitation, a syncopal attack.
Sorry, Doctor, you probably can stop the share screen so that we can have a screen of you. You stop
Okay.
share.
Sorry. Stop sharing. Okay.
Okay, good. Okay, there's another question from Hi Chloe. Chloe Cham is, the fibroid could disappear itself?
Very difficult to say fibroid is disappear itself because what you call is a growth inside what you call a muscle. You should remember that fibroid is very common for women aged above 30 years old. 30% of women more than 30 years old, they have fibroid. But majority of them, they have no problem, no symptom at all. But 30% of this 30% has some problem. Anemia, irregular period, and then bleeding. And 30% of this 30%, sub 30% has surgical intervention. So if you ask me, can fibroid disappear? Even if they have menopause, it becomes smaller. It won't be disappear.
Okay. So probably I can ask doctor a question. Because there's a myth that when girls' periods, we don't take cold water or we don't take cold stuff like ice cream, and this possible that cause excessive bleeding. Is it true?
Not really. No, there's no relationship between the cold water, hot water, cold weather, hot weather with the menses. Not really. But stress, yes, could be.
Sorry?
If you are stressed, yes, could be.
Oh, stress. Okay, thanks, doctor. Okay, then the next thing. Okay, because just now you said that excessive bleeding do caused by uterine related conditions like fibroid. So fibroid seems like a recurrent healthcare problem. Any way actually to prevent? Because I have friends that actually they have did the surgery to remove the fibroid, but yes, few years later it's come back. So is it because of diet or any diet that can advise to prevent such condition to be recurrent?
Frankly speaking, I'm not aware about all the special diet to make what they call this uterus smaller or fibroid smaller or to prevent it. Very difficult because I told you this fibroid is very common among women because it depends on the female hormone. So there's no of I can't suggest any good vitamin. I cannot suggest a good food or good drink, but all of us should have what they call good healthy diet.
Okay, that's the way to prevent. Okay.
Yeah.
Okay. Okay, we just check. Okay, is the excessive bleeding right during menses is a sign of hardened pregnancy?
Yes. Sign of pregnancy.
Hardened, hard to get pregnancy.
Hard to get pregnancy. Oh, yeah. Yes, definitely. Because when you have excessive bleeding, mean that your dry time, when you have a dry time, you know what I mean. So let's say you have bleeding for 2 weeks of the months. So when is your dry time? 2 weeks or less. So when you not dry, you won't have sex. One thing. So your sexual alcohol frequency is reduced. So definitely its chances to get pregnant reduced. Second thing, there could be some growth around what they call in the lining of your womb. When there's a growth, something what they call is polyp, fibroid. So it's very difficult to the pregnancy to get implanted in the uterus. Yes. Yes. If
Okay.
you ask me, excessive bleeding very make the woman difficult to conceive. Yes, I agree.
Okay. So, okay, there's a good patient. There's a question from Peja. Hi, Peja. Doctor, do I need to worry if I have severe period cramp every month since puberty?
Okay, you have because how do you find your severity? Because you have severe period pain, but you never go to doctors. Do you think they're severe? You know what I mean? Sorry. Okay, so severe usually but something that new one. Because period pain is very common among women, especially teenagers. Okay, what make they worry actually when the pain is become more become severe, painful, more painful. So that's why they come and see doctors. But otherwise, with normal period, you can say released by the Panadol or paracetamol, or just some simple painkiller for years, nothing happened to them. Yes, but
Which is normal. Yeah.
it could be normal. Most likely could be normal. I can say.
Okay, okay.
But
Means that pain
any
until cannot tahan.
but if you make your what you call mind clear, why not you come and see doctor at least once a year to have a screening? Yeah.
Oh, okay. Okay. Okay, and then hi Nur Farah Hanim, about the contraceptive pill. I ada baca yang if we take prolong of contraceptive pill can cause cancer. Is it true?
Yeah, I just told you what just now. Combined oral contraceptive pills. I'm pro combined oral contraceptive pills. Even my wife took it. No, took it. Okay, okay. Because
Oh,
why?
bercelasa.
Yeah. Because what I think I deal with what they call cancer patient a lot. So I told you last time, previously, just now, if you take combined or you should remember there's a lot type of contraceptive pills. One is mini pills. One is combined oral contraceptive. Combined oral contraceptive pills mean that there's two type of hormone inside one tablet. Okay, you may discuss with your doctors. Okay, if you take combined oral contraceptive pills for 5 years, either continuously or accumulative, means that one you take it and after that get pregnant, and then after that you take it for 2 years and then get pregnant again, and then accumulation of the what you call the intake is around 5 years. Chances of this woman who take these contraceptive pills compared to women who never take the contraceptive pill, the chances them to get cancer of ovary and endometrium. Endometrium means that lining of the womb is 50% less compared to this population who never take this contraceptive pill, but must be 5 years. This is what they call is proven based on the research, and the doctor also call it is chemoprophylaxis, mean that the prevention by drug. This is one of the best medicine to prevent cancer of the cancer, especially the uterus and ovary.
Okay. Okay, I hope Nur Farah doctor answer your questions. Okay, there's another question. Is it after give birth you change the heavy period condition?
Okay, when you immediately give birth, okay, you
After
have
give birth.
yeah, after give birth, yes. First 6 weeks the confinement time, yes, because you still have what they call pregnancy hormone to come down to get the normal hormone level. But after that, you combine with what they call the breastfeeding. When you have breastfeeding, usually you won't have period because this what they call lactational amenorrhea method, meaning it also contraceptive, especially the first few months of delivery. And people what they call have no period, mean that the hormone level is changed. Yes. I agree, especially for first 3 to 6 months after give birth.
Okay, so probably another questions. Okay, there are some abnormal conditions that usually we girls are doubt when we want to seek for medical help, like sudden missing periods, like 1 month, then after that the next month it become excessive. So is such condition that we should do immediate consultations, or actually it's quite normal?
First of all, you have to make sure either you're pregnant or not, especially you have sex, because this is the most common cause pregnancy. Mean that it could be just what you call a threatened miscarriage or miscarriage, because majority of the miscarriage actually undiagnosed. Suddenly they have what you call missing period. They have no period for 6 to 7 weeks. Suddenly they have pain and a big clot come out, and it could be pregnancy. And then if you ask me, should you worry? One thing you should do, actually, you see your general practitioner, and then the general practitioner will check, will confirm with you with the history taking everything, and then they will do usually pregnancy test or simple ultrasound scan first. So should you worry? Most of the time it's okay, but if you want to clear your mind, you better you see a doctor.
Okay. Okay, guys, probably we wait another, we can take one more question. So
Okay.
we are waiting one more questions from the floor. Okay, just probably I gave my last questions to Doctor. Beside excessive bleeding, sometimes we will have a menstrual blood clots, large menstrual blood clot. Is it one of the sign of having woman sickness, woman health sickness?
Yes, if you ask me, especially women who age 40 and above, if they have what they call high risk of what they call cancer, especially the endometrial cancer. First, actually, uh, they are obese. They have diabetes mellitus. They may have what they call hypertension, and then their period actually could be what they call every 2 3 months, or their period actually continuously a lot and with blood clot. They should have been screened for uterine cancer. If you ask me, yes, because this is a risk factor. Other than that, young girls, young ladies, you should rule out that either you're pregnant or not. This is very, very common.
Okay, I think today we should have the end here. Okay, just last check out. I think no more questions from the floor.
Okay.
Really thanks, doctors, for taking your time, your evening here. I know you are rushing just now. After just really appreciate. Oh, okay, there is another. Okay, we answer the last question. From Chloe, should I take any medicine for fibroid cases? I think this is our last question, yeah, guys.
For fibroid.
Yeah, medicine for fibroid cases.
If you ask me, fibroid is very broad spectrum of management. So one thing actually, based on your severity of your symptom, you know, actually majority of women age above 30% of them have fibroid. You should remember that most of them have no problem. So usually less than 5 centimeter, no problem, we don't disturb. Unless actually is disturb the lining of your womb and you want to get pregnant, because they want they disturb the lining of your womb, something like this is your uterus, and then if the fibroid go inside the lining of your womb, we have to remove it because it's very difficult for pregnancy to get implanted, even though you have no other symptom except difficulty to conceive. This is your main symptom. Okay, any other medicine is if you have no symptom less than 5 centimeter usually, and then doesn't disturb the lining of your womb, you have fantastic menses, you have good life, no period pain, don't do anything. You can monitor every year for looking check up, but don't do anything. So Is there any medicine? That one don't need anything, don't need medicine. Second thing, actually, if you have fibroid which disturb your life, bleeding, and then anemia, and then what they call painful. So there's a few medicine. One thing actually is to reduce what they call to prevent anemia. We give the iron tablet. We give just now. If bleeding a lot, we give a tablet to reduce bleeding. Or sometimes we give injection hormone. Why? Because we know this fibroid depends on your female hormone. When we give you this injection, so it will suppress the hormone, it make you temporarily like menopause woman. So the aim is to reduce bleeding. Second is to make sure your hemoglobin go up. And then third one, to prepare what is the next step, because these injections all are temporary. The next step is usually operation. Okay. Other than that, we haven't discussed actually is radiological intervention. Mean that there's one method where we do it. We block. We do MRI. We look at the fibroid, and then the position of fibroid, and at the same time look at the blood vessel to the fibroid. We can do what we call uterine artery embolization, mean that we block the blood vessel which go to the fibroid, mean that the blood supply to the fibroid will be much reduced, so the fibroid will be lower. Okay, any special drugs for fibroid? Previously, we have a special drug for fibroid. It's a very good drug. Somehow, the company, withdraw back the drugs globally because they have found that there's some side effect. So until they have review back about the side effect, and then we may continue. But this was a good drug actually, but the side effect is make the company stop and let the medicine at the moment.
Oh, okay, okay. Okay, thanks, doctor, for answering all the questions. And thanks again, doctor, for taking your time. I know you are quite rushed today. Really appreciate you taking the time.
Okay.
And I know you're still not home yet. Guys, I think you should thanks doctor for today's visit.
I reached home actually.
I reached home already. I was so fast.
my house is in front of the hospital. 600
meters. Okay. No wonder so fast. Okay. Never forget. Please. Guys, never forget that do help us to share out this video, Dr. Zaha's videos, so that more people can benefit from it. Before we end, I would like to inform that this coming Wednesday, we are going to have a topic by the aesthetic physician, Dr. Alicia, to talk about the latest advancement in medical aesthetic. So it will be presented in Mandarin. So the right clinic, the right doctor, the right care, the right information, the right knowledge, no panic, stay at home. Good night, everyone. Good night, doctor.
Okay, thank you.
See you guys soon.
Okay, bye.
Bye.
Bye.